Mambo vipi Anita Santuri hapa, karibu tena siku nyingine. Ni Alhamisi kama kawaida, kila Alhamisi na Jumatatu huwa tunakaa chini tunapiga story na watu tofauti tofauti, na kama kawaida huwa sipo peke yangu studioni. Kama ndo umejiunga na sisi leo, tafadhali subscribe, enda ukalike, comment. Kama una issue ambayo inakusumbua, nifuate pale social media at Anita Santuri. Let's have a conversation. Kama kuna kitu ambacho tunaweza tukakaa chini tukazungumza, why not? Leo niko na mgeni wangu, na mgeni huyu leo ni vitu tofauti kidogo. Tunaingia katika tunaitaje health field. Yeah, health talks. Yes, na leo tunazungumza mwezi mzima, mwezi wa 3 ni mwezi wa C-section ama cesarean month. Yes, na leo tunataka tuzungumze, I think wanawake wengi siku hizi maybe una opt kwenda kwa C-section ama ni emergency ya kufanyiwa CS kwa sababu zako tofauti tofauti, na leo tunalizungumzia hilo swala. Tunaangalia ni mambo gani ambayo watu wanayazungumzia ambayo si ya kikweli na yale ambayo ni ya kikweli. Kwa hivyo kana sisi upate kujua. Karibu sana.
Thank you so much.
Karibia kidogo mic kidogo tu ama
okay.
Yes, hapo.
Then first of all, Anita, you didn't tell me you're going to use Swahili. Swahili is on point. So I'm going to give you a run for your money with my English. So I hope your audience are going to be comfortable with
It's
that.
okay. Lakini naweza nitafurahi kidogo ukichanganya kidogo tu. Jaribu. Naomba utuambie unaitwa nani na unatoka wapi na unafanya kazi gani?
Okay, so professionally my name is Dr. Grace Kanyi. I am an obstetrician gynecologist, aka daktari ya wamama.
Daktari ya wamama.
Daktari ya wasichana. And I serve in Tharaka Nithi County.
Tharaka Nithi County.
Yes. County number 13.
Yes. County ya huko 13 inakupeleka namna gani?
So far so good. I'm able to actually see the impact of the kind of service that I'm offering to the girls and women in that county. So I'm actually happy with the
kuna county zingine madaktari washagoma tayari hivi.
But you understand the concerns behind it?
Yes. I had a conversation with Bamji Atela. Yes, last week, and wakaja wakatueleza nini kinaendelea, and it makes sense.
No healthcare worker ever wants to stay at home.
Yes. Okay. Umeshaisomea kazi, lazima ufanye.
And it's a gift. Yes. Then by the time now you also a specialist like I am, it's, you know that thing we say, it's a calling, it's a gift, it's something you're very passionate about. So nobody will choose to actually stay at home and not be at work. So plus I also know that the respective counties are putting efforts to resolve whatever issues are there.
Turudi kilichotuleta leo.
Politics aside, that's not my cup of tea.
Now, cesarean month.
Yes, April is the month we use to create awareness around delivery via cesarean section.
Watu wanasema wanawake ambao wanafanyiwa CS sio wanawake kamili kabisa.
Okay, fine. We have heard those statements, but that is not true. So, and that's why when I was doing my education through my own social media platforms, the number one thing I wanted women to be aware about, you are a mom, irrespective, first of all, of how you conceived that baby. Because you understand some women, there are those who will conceive naturally. There are those because of 1, 2, 3 issues because of infertility. They have conceived through IVF. Okay. Some have conceived through, we call them assisted reproductive techniques. You're still a mom.
But wewe unazaa, wewe ni mama tu.
And then there are those who, because they really cannot carry their own pregnancies, is through a surrogate. You're still a mom. Okay.
A surrogate inakubaliwa Kenya bado?
Yes.
Okay.
Yes.
I think my third child.
Yes.
Tunaenda huko.
Yes, because there are some people who have really health issues that would put them at such high risk of carrying a pregnancy. They shouldn't be denied that opportunity.
Yes.
You're still a mom even if you have adopted that baby. So you're still a mom if you had a natural birth, what people now call, natural birth, vaginal delivery. And you're still a mom even if you had that baby through a C-section. Okay? And you're also a mom even if your baby was born sleeping.
Yes.
And for those whose babies come, way too early, a miscarriage, you're still a mom. Yes. So you see the definition of mom is wide.
Broad.
Yes.
Karibu sana. Yes. And kuna watu ambao mtu anakaa chini anasema, mi mwanamke ambaye amezaa mwenyewe naturally, ndo mwanamke ambaye naweza nikamtambua the moment ukizaa na C-section, you can only have maybe 2 births or 3 births. How many births can you have ukiwa umefanywa C-section?
Okay, so that first bit that you've said, that I can only recognize a woman or a mother who has had delivery by C-section,
yes.
yeah. But now what we also use this month to raise awareness around is that there's that woman who really wanted to have a natural birth.
Yes.
Then it's never a straight road, okay, from the onset of labor to delivery of the baby. So they tried. But because we wanted the mom to be safe and baby to be safe, we went for that option of a C-section, okay. And then the other bit of the question was the last bit. How have I forgotten?
Mwanamke ambaye amefanyiwa C-section.
Oh, how many babies?
How many babies?
Yes. So what we tell mothers is this. So we'll explain to you what a C-section entails, okay? Then we'll tell you the next time you come for a C-section, we are still going to use the same path. So that now, you remember we are doing the bikini scar on the skin?
Yes.
So even on the uterus, it's more or less the same. So you're going to be using the same spot. Okay? So you want the mother to understand, kwa mfano tu kama ile kiraka yangu, tukishinda tukirepair, what happens? It becomes weak.
Yes.
Okay? So what we do these days that we explain the added risks to the mom.
Okay.
Of course, we will do our best to prevent those risks and to mitigate those risks. Okay? But I don't think we want to see you the 10th time.
Oh, yeah.
No, we don't want to see you the 10th time.
Yeah.
But then also you have to be very careful and balanced, because you may find somebody who had baby number 1 who passed on, baby number 2 who has an issue. Yeah. So she's had 3 babies who were born through CS and they're not here. You can't tell her not to get another baby.
Yeah.
So again, the bottom line is we'll explain the risks for you. How do we mitigate those risks so that we keep you safe?
Yes.
And then we go ahead. Then definitely there are those ones who, when you're doing the C-section, you may find kumeshikana kule ndani, wajua, the scar you're seeing up here is the same way inside there.
Iko hivyo.
Some people heal now with even worse scars. So with that we mean kutoka kumeshikana. So kuna kushikana nyingine kule ndani itakwambia, hey mom, the next time the C-section is likely to be a little bit challenging. Okay. And that's even how now we tell those women, during your next delivery, let it be done at a center where an obstetrician gynecologist is. So it's always important to be giving that sort of feedback to the mom. How are things inside there? Okay. That said, I've seen women who are coming for their 4th scar, and inside there things are pretty good. Okay. And I've also seen women who they're coming for their 2nd scar and things are quite zimeshikana. So it's with guidance.
Kwa mfano kama ndo umeanza kujiunga na sisi sasa hivi, tunazungumzia kuhusu masuala ya C-section ama cesarean. Kwa wale watu ambao labda hawajui cesarean ni nini, naomba waeleze kidogo kwa upana. Cesarean ni nini?
Okay, so cesarean delivery, aka CS, means people know it as a CS. It's now when we have to make an opening on the mom's lower abdomen. Then we go and make an opening on the uterus.
Okay.
And deliver the baby. Okay. So of course you have had the thing that, for CS, the mom we opened 7 layers before we got to that uterus. Yes. So deliver the baby, deliver the placenta, and then now come repairing everything up. So in short, it's a delivery of a baby through an opening made on the mom's abdomen. So now the next question will be, when do we do a C-section?
Yes.
Okay. So first of all, we have made many assumptions that we had preconception care, which I'm very passionate about, is that a young couple or a young woman wishes to conceive. And so we encourage them to come to the OB. You tell them, hi doc, I would want to conceive.
Planning to.
Like the next 6 months, how do I prepare myself?
Yes.
More or less like the kitchen garden, which is very important because you'll find some people have chronic underlying conditions. It could be somebody who has diabetes. We want you to be very well controlled by the time you're conceiving so that we minimize complications.
Yes.
Could be somebody who has hypertension long before she's conceived. So certain drugs, again, that we would use outside pregnancy, we don't want to use them during pregnancy. So now it's when you come for your preconception care, we have that discussion. So let me just mention top of the list those women that we really want to see for preconception care. So any chronic underlying disease, chronic means mekuwa kwa muda mrefu. Kisukari, kupandisha pressure, epilepsy, aka kifafa.
Yes.
Of course, patients who are women who are living with HIV, because we want the next generation to actually be without that. any person who has had a heart disease, and these days now we are beginning to onboard patients with chronic kidney disease. Just come so that we try to optimize
Ujipange na
this
mapema,
baby.
yes.
Yeah. Then of course now we go through ANC clinic. From the second trimester, we need to start telling you
yes.
what are the birthing options. Okay. And this becomes important because if you've had C-sections twice, mom, there's no discussion. Already we write on your book, we are going to have this baby 1 week before, and we document that in your book.
In the book.
So most of the time,
so personally I've had 2 CS.
Yes. So tutakuja pale kwa clinic, siku ya kwanza tumekufanyia scan. We know the EDD ni ile siku ambayo tunatarajia mtoto akuje. Now for you has had 2 C-sections and above, or even 1, actually 1 and above. But now for 1, I want to discuss, there's room for us to try a normal birth. We'll write for you the book. The baby is going to be delivered on this day.
Yes.
Of course, I know the modern woman has special requests. I want the baby to match my spouse's or partner's
birthday
or my best friend's birthday. So we'll navigate that around.
I think people normally think I did the same with my kids. And I didn't. My kids, they share the same birthday.
You're sure you didn't?
I didn't. One was supposed to come, my firstborn, on 22nd of April. So akachelewa. By the time madaktari wanasema now we can do this, it's 15th May. Oh yes.
Okay.
Aya. So now, CS. Because nimekuwa kwa labor 4 days. So I had to check myself out of the institution where I was. I had to go to another hospital because the superintendent in that office was my friend. So kanambia, just check out yourself. Kuja, nikutafutie space, ufanywe CS.
Okay.
So nikaenda nikafanywa CS. Na nilifanywa CS kwa government hospital.
And I know you enjoyed the service.
Yes, not fast, but then baadaye ndo nika that's a long story. Unfortunately, because of that long time, my son has CP. But now the second born, time yake ya kuzaliwa ilikuwa anafaa kuzaa on 17th of May. 17th May nikapata labor 14th usiku.
Okay.
14th usiku. Mimi sikutaka kungoja. I had the first problem.
Yes.
I took myself in the morning to the hospital.
Yes.
Wakaniambia ikifika saa 7 kama bado hujafunguka njia, tunafanya CS.
Now you're explaining now why I was about a little bit reluctant to say once a CS, always a CS.
Yes.
Okay. So we have talked about the planned cesarean section. So it means right from the time we start clinic, we already know when this baby is being born.
Yes.
Okay. But that said, we will tell women ANC is very fluid. If anything happens, that date can change. Okay. Then now there's that lady who had a first CS, but the reason for that first CS haijirudii mara ya pili.
Okay.
So kwa mfano, if mtoto ameketi ama amelala upande,
ama mesijua kona cord kwa shingo.
Cord around the neck is not an absolute reason for a C-section, especially if you're in a good setup where we can monitor labor in real time. So it will be something like either the baby amelala upande, kuna wale kulala na side, wako beach. There are those babies who wamekuja na sitting allowance, the bridge presentation. But now for the second pregnancy, baby the head is down, the weight is good, it needs to be less than 3.5. We can try that scar.
Okay.
But trying the scar, if you're watching me, be very careful. You're not trying that scar at home.
In the hospital.
Even now we'll be discussing it now from week 34. Those danger signs, and we teach you, we even show you in the book, we mark it, okay? So that if you feel anything, you go to the hospital. Do not try the scar at home, please. Okay? Because again, it needs to be now set up where the birthing unit is aware we have a mom who is trying a scar. So you try a scar with theater ready. Okay?
What do you mean try a scar? Hiyo scar inatraiwa aje?
So we're trying the scar because we're saying you had a first CS.
Yes.
Mtoto wa kwanza ni kwa sababu alikuwa ameketi vibaya. Let me use that word. But this time round, the baby's head is the one ndio inatangulia, kichwa iko chini.
Which is normal still.
Yes, that's the normal. And that's what now we usually try with a normal labor. The baby is less than 3.5 kilos. And there are no concerns at all. So that's why we are saying we are trying the scar. You have had a C-section, but you want to see if we can have a normal delivery. That's what I'm telling the women who are watching. You can try that. It must be in a hospital.
Okay.
And the birthing suite, watakuwa tu alert. Utakuwa tu unaona kila mtu anakuchungulia hivi. Tu iko namna gani? Okay. Kuna bleeding. So even the threshold for doing a C-section, any small slight issue, we would rush you in for a C-section. Because the worst case scenario is where the uterus can rupture.
Oh, okay.
Okay, because remember there was a scar.
Yes.
Okay.
Okay.
Then the other reasons for performing a C-section, so either the baby is too big. Okay, so tutakuwa tumepima ile njia ya mama. Tunaona mtoto ni mkubwa.
My son was 4.2.
Yes.
That was a huge baby.
That was a big baby. So a big baby, again, we know they wouldn't be able to pass after we have done the assessments. Then also the mom could actually be the one who has a small pelvic bone.
Oh, yeah.
And this is not something you're going to look at someone and be like, your pelvic bone is small. So you'll be...
Now you can know this during wakati umefanya scan.
No. So usually it's during admission into labor ward.
Ndo mtajua.
When we do the assessment. You know that assessment that we all don't like? Yes, I know we don't like it, but that's the only way we can be able to assess the pelvis truly and correctly. Now, be able to tell you this pelvis is quite small. And if you tell your mama the pelvis is small, please know that's a permanent thing. So your next baby, your next babies will be born via C-section. Okay. The other reason will be, for one reason or another, baby is not tolerating labor well. Okay. So you remember when you're in labor, the assessments are quite frequent. Okay. So depending on which hospital, some are able to do it in real time. Na kuna jokoni ile kufungwa mshipi na mashini iko pale. So hata mwenyewe unajionea vile hiyo heartbeat vile inaenda. Okay. Where we don't have that, you'll always find the staff in the bathing unit. They'll always come to listen to the baby. They will update you. So many of the times it will be that the baby's heartbeat is way too fast, or the baby's heartbeat is way too low. We'll put some corrective measures, but if it doesn't work, we will take you in for a C-section. Okay. The third reason will be the baby is fine, but njia ya mama ifunguki. You know?
My problem.
Yes. So we will try to help you with that. Again, there's a limit within which you're trying. So I usually say labor and delivery is one of those things where you have to monitor in real time. So baby is fine, but the mom hafunguki. So you put in your interventions, nothing is working. So we'll take you in because your labor is not progressing as it should be. All right. And then there are those mothers who will just not be able to tolerate labor.
I just want this thing. Get over it.
No, so they try. They're fine. They're progressing well. The baby is tolerating the labor well, but the mom is just like, no, I can't. So we will cancel. But at the end of the day, you'll be like, okay. Because why? Yeah.
And you can...
She's just like, no,
I can't do it.
No, I can't. So those are some of the avenues under which we can do a C-section.
And what are the risks? So risks are both kwa mama na kwa mtoto. When someone decides, or maybe you've decided to go that road, C-section.
Okay.
Yes, during and after.
During and after. So I hope it's clear that a natural birth is what we all will be aiming at.
Yes.
Because it has some of the least complications. So for now, a C-section, remember now there is that bit of giving you anesthesia.
Yes.
Okay. And many people have never used anesthesia. So number one, top on the list in terms of risk, we don't know how you're going to respond to this anesthesia. And you'll actually find the anesthetist, many of the times, they start that counseling with that statement. Okay. So the risks of anesthesia could be quite several. You've heard of people who go to theater and they don't wake up, and you come and tell them that it's because of the anesthetic complication. There are those who, in the course of the anesthesia, their blood pressures just drop. But the beauty with that, if you're working, of course, you're working with very qualified people, they'll be able to see it's happening and it will be corrected as soon as possible. Then now the rest will come now to the procedure itself. So usually it's like explaining it from the skin going downwards. So we are giving you a scar on your skin. So one of the complications is an infection on that
on
scar.
The scar.
Yeah.
When it's not healed yet.
Yeah, like it becomes infected.
Okay.
So that's how you start seeing some women will tell you inatoa usaha, kuna maji inatoka. Okay. So we call it a wound infection. To mitigate that, we give you antibiotics for a week. Yeah. Then number two, there are those people, delivery process is bloody. You will lose blood.
Yes.
Okay. So on average for a C-section, between 700 mLs and 1 liter. Beyond
That's
a liter.
A lot.
I know. Beyond a liter, that's a lot. Okay. So again, it depends. Are you coming for delivery with HB of 9 so that you lose 500 mLs and you're really affected? Yeah. So there's that element of blood loss. And again, there are measures we put in place to protect you from that. But for some women, it can be too extreme. And that's how you'll end up hearing, we're calling for people to come and donate blood for somebody who is delivering. Some women have ended up in ICU dialysis because of that. And the real extreme is where we have to remove that uterus because it's just bleeding way too much and we can't seem to stop the bleeding. So it's something that women need to be aware about when you're going for a C-section. Okay. Then still to mention on that, because of that scar, now future placentas, instead of ende ishike kule juu kule kwa uterus, comes to attach itself huko chini. Ooh, that's usually something which is quite dangerous. Okay. Of course, it's our job to optimize your care. But just want the patient to understand your placenta is down here. And sometimes that placenta, badala ishike tu pale undani ya uterus, nitaingia huko ndani kabisa.
Mimi ni stubborn.
Mimi ule hata sitoki. Now, those women now, extra measures have to be.
What are some of these extra measures that we're talking about?
So you, during your ANC, and that's why please attend your antenatal clinic. And when we tell you to do ultrasounds, we're trying to optimize your care. So you'll see that on an ultrasound. In very good setups, you can do an MRI. Okay. So very early, you're able to know. Hii placenta ni ile imeshika shiki. Ama ni ile ambayo nitatua tu easily. Now, if it's those ones which have really have penetrated the uterus through all the layers, and sometimes you'll find the placenta which is even, touching on the urinary bladder and matumbo, what we know is try as much as possible to leave it in place. But now coming to explain to a client, I didn't remove the placenta. Like, what were you guys doing? Okay, so it can happen.
Now it becomes a problem.
So it can happen, and you will explain to the client what happened and why we didn't remove it. Because now attempts at removing it will leave the mother with torrential bleeding, and that torrential bleeding then will mean you're removing that uterus. Then the other complication is because after surgery, people don't walk a lot. And because of other mechanisms during pregnancy, the risks of developing blood clots now are quite higher. So it will be higher just purely by being pregnant. It will also be higher purely that I've delivered. Now add a C-section on top of it.
And I can't walk.
Yes. That's why you'll start seeing in some hospitals, first of all, if you're obese, if you're at risk of developing blood clots, you'll start seeing 24 hours later, you're being given an injection which is for thinning out blood to protect you from that. Okay. I think top of the list, that's what I can think about in terms of complications for a C-section for the mom.
Are there any for the child?
Any for the baby. So number one, it depends on the type of anesthesia that we have used.
Okay.
You may have noticed that majority of women these days, you're doing your C-section when, it's just your numb waist down.
Yes.
You're fully engaging us.
Hatupendangi
pia. Because now the one we call it the spinal.
Yes.
It's quite friendly to the baby as well.
Okay.
But now, for one reason or another, sometimes you're forced to go for the general anesthesia where the mother has lad. Now, that one, usually we have to shorten the time to get that baby out because sometimes also the baby atakuwa amevuta ile. Yes, yeah. Okay. So that's why for women, we try to educate them a lot. The spinal one is far much better, both for your uterus and for the baby as well. Okay. Yeah. Wow. Then now, the other set of complication to the baby will be arising from why were we doing this C-section?
Oh, yes.
Yeah. Yeah.
Some of the reasons ambazo zinafanya watu wanafanywa CS mara nyingi either ni kusaidia mama ama kusaidia pia na mtoto kutopata complications. Some of these parents like myself, yes, nilifanywa CS but bado mtoto wangu alipata complications. I have my reasons why and I know why that happened, and I've forgiven the doctor that took his sweet time to make sure that he knew I was supposed to go through the C-section, but he took his sweet time, and to top it up, I think alitupatia intern. So the intern was not very aware of what he was supposed to do. But thank God he's the one who suggested that I should just check myself out of the clinic. And I would not advise someone to go and have a baby in a clinic, in a hospital which is not very established, because some of these people maybe don't have the proper information they can give you. But that's a story for another day. Now, back to aftercare. Tumefanyiwa CS, tumerudi kwa ward. What's the aftercare?
Okay, we have already skipped a lot, so I will go a little bit back.
Tumeruka vitu vingine.
Yes,
okay.
Yes.
Hebu turudi kidogo.
Yes. But allow me to say that I am really sorry that happened to you.
Nah, it's okay.
And to, kukupatia heko, for using this platform to raise awareness of what happens in the labor ward and how a patient can advocate for themselves as
Thank
well. All right. I'm pretty sorry that happened.
It's okay.
So we skipped the part where how do we prepare you for a C-section?
Oh, yes.
Yes. Okay.
I think that part nimesahau because it always plays in my mind how I'm wearing that green gown.
Which is open at the back.
Yes. You're waking like you're butt naked like that.
I know, yes. So how we prepare you for a C-section? So we're going to check the arm where it's a planned one.
Okay.
But it will mirror more or less what happens during an emergency.
Okay.
So, of course, we will admit you into the birthing suite. So, around the time when a C-section has been prescribed, we will tell you, why are we doing the C-section?
Okay.
Mama, we always tell you. If someone doesn't tell you, ask. Why am I going for a C-section? And we always want to use a language which is easy for you to understand.
Zile maneno kubwa zenye mtu hatazielewa.
No. I work in a county where I was not born in that county. It's in Tharaka. So I don't know the local dialect. But if you don't understand it, I will ask the nurse to come and explain to you so that you understand. So then when you come into the clinic, I ask you, what was the CS done? I don't know. Which hospital was it? So please, I know many of the times adrenaline is high, but just try to understand. Okay. Then after that, we're going to draw some blood. Okay. So the blood, top of the list, we want to prepare blood for you. You're going for theater. Okay, we want blood on standby in the event you need it. Okay, then of course we want to know other parameters. Then after that, we're gonna place ile sindano kwa mkono for at least 2 days. Yeah. And you will notice we never put the small one. Have you noticed?
And then you can't even bend your hand like this because inapita na hapa kama ni inaweza pita na
excuse me, kuweka mpaka you can actually brush your teeth and clean yourself.
Mimi sikuweza kubend more.
Okay, because now some women will tell you, why are you putting that? Me, I don't want it. So we explain it for you.
Okay.
That it's actually a safety measure for you.
Okay.
We will put our drugs through it. And you never know. We may need to resuscitate you through that. So please, tukikuwekea hiyo sindano kwa mkono wakati tuko labor ward, ni kukusaidia mama.
Okay.
Okay. Then after that, now we take you to the labor ward room to prepare you. We will listen to the baby's heartbeat. Okay. An ultrasound will be done as well. And then we will tell you, depending on the policy of the hospital, our wish is to insert the catheter in theater. But we know some hospitals, the staff in theater will be like, iko wapi hiyo catheter? Hamjaweka catheter, rudisheni mama mkaweke catheter. Okay?
Yes.
Then again, depending on the policy of the hospital, some people will shave you. Others will not.
Ama uambiwe wewe kuja ka umejishave. Ukienda kliniki yako ya mwisho.
Yes.
Usikuje na msitu.
Yes. But either way, you don't worry. We will sort you out.
Okay.
And then after that, now you start noticing we run some drips. Alafu tunakwambia now remove everything. Okay, so if you have a fake tooth, we want you to remove that. If you have a hairstyle where there's that burn over here, you start noticing we actually are releasing it. So that kulala flat before. Of course, I know we are in the era of wanting very beautiful nails. You can see mine are short. But if yours are long, we will tell you kuna moja tutakat. Moja ndio at least kwa tumeweza kuweka something that we use for monitoring your oxygen levels. Yeah, okay. There's some who they will come with them like that. You fika theater, the staff are like aki itaingia. It's fine. We'll just cut that one. We'll leave you with the rest of your nails. Then there's a paperwork that now you have to sign, which is the consent. Okay. Where we have explained to you again what are we going to do, what are the risks. Okay. All right. And then after that, now you're walked into theater. So either on a wheelchair or on the gunny. Okay, but I've seen some women who tell you, no, me, I want to walk on my 2 feet.
Hata mimi niliwaambia nataka kutembea. You know, that thing makes you feel really sick. And you're not sick, you're just having a baby.
Yes. So then now when you're received in theater, we try as much as possible for the theater staff to introduce themselves to you. Yeah. All right. So who is the obstetrician? Their role is to deliver your baby. Then they will have what we call an assistant. His or her role is to assist me during that procedure. Yes. There's the anesthetist, especially if you have been laboring. They are your best friends, because in less than 5 minutes your pain is gone.
Oh yes.
Yeah, they usually are the heroes of the moment. Nakwambianga, mami ndio beshte yako, by the way, nipe tu dakika 5 hiyo chungu itakuwa imeisha. Okay. And then there's usually someone else who runs around theater to help, and the nurse who's going to receive your baby. Again, people may have noticed these days in theater we are quite friendly. Tunakuchapangianga stories huko.
My second born nilipigishwa story sana, but now I started shaking. Nilikuwa nasikia baridi. Yes. What causes that?
So the baridi, so you'll also notice at some point kuna tembe tutakuwekea chini ya ulimi.
Tembe.
Nakwambia it will give you that shivering, but it protects you from bleeding. Remember what we said, there's a risk of bleeding.
Yeah.
So there are those drugs you have to use to protect you from bleeding. Now the downside of them, they really make you shiver.
Mimi nilitetemeka even after having the baby. When I went to my ward, nilitetemeka for like 4 hours.
No, at most it's like an hour.
Nilitetemeka. My mom was mpaka alikuwa anaanza kuomba, anasema my daughter is dying.
Oh, I'm sorry.
4 good hours. They had to give me tea. After 2 hours or 3 hours, wakanipatia chai, maji moto. Yes, because it was bad.
It was bad. So now what we commonly do after delivery in the recovery room, you'll find you're being covered a lot, and a heater will actually be placed around you to help you with that. There are those men who will tell you, after delivery at some point I had a really bad headache. And if they were keen enough, they will remember. The anesthetist told them, you're going to have a very bad headache for like 30 seconds. Again, it's because of the drug that we are using to stop you from bleeding.
Okay.
Then the shivering also could have been worsened by the fact that sometimes in some setups, ile maji unawekewa kwa drip is not warmed. So it could have been at 3 a.m. in July, August, and they're giving you cold fluid, so that may have worsened it.
Yeah.
That's pretty much now what happens. So when your baby is born, you actually see your baby yourself. You acknowledge.
And I made sure my baby cried because my firstborn didn't cry. What are these things that a mother should look out for when you're in that theater?
Just enjoy the moment.
Enjoy the moment.
Of course, many women will be very calm, so we'll try to make you understand we are team you.
Okay.
And all of us here, at least 5 people, bare minimum, we're just here for you. So the most important thing we even tell them, just raise your concerns. Just tell us, what are you feeling? That's why these days you'll notice, no chapanga story. The stories are intentional.
By the time you are done.
So it's to calm you down and to be able to pick when something is happening. Because suddenly you're like, oh, hi, Anita, how are you?
Quiet.
Umetoka wapi? Mahindi imemea. Umepanda nini? And then you're beginning to blah, blah, blah. Now the anesthetist picks it up very fast. Of course, the monitors are there, but that also helps a lot.
Okay.
Okay. So kuchapa story, just talk to us.
They told me I was passed out.
Sorry?
They told me I almost passed out when we were talking. I didn't realize it. It was happening, but I wasn't speaking. My eyes were open, but I was not speaking. So I don't know what they did, but then everything else went back to me.
Yes. And of course, now the beauty of spinal anesthesia, you acknowledge your baby.
Yeah.
Like immediately.
Yeah.
And for moms now who are delivering their rainbow babies, it's always such a moment. I keep on telling people, I get goosebumps with every delivery. It doesn't matter how many babies there are right now. I lost count. It's always magical,
You can't tell how many babies you've delivered right now?
I have been in practice since 2012.
And
this is the only thing this is majority of one of the things that I do. So it's always one of those amazing things when moms are meeting their babies. Of course, we will wipe the baby for you, keep them dry. Head to toe assessment is done. So the nurse comes and tells you, okay, look at your child. Is it a boy or a girl? We identified soonest by that. Then now from head to toe, you want to show the mom the baby and let them know your baby is actually very perfect. Okay. Then if it was we came in for a CS because something was going wrong during labor, now we'll explain for you some of the changes that you will see, but then I will reassure you over the next 48 hours those changes will have gone. Yeah.
Now the aftercare.
The aftercare, na hiyo kutetemeka, nitango paku. The recovery room where you really want to turn but you can't turn because from the waist downwards, So during that moment again, if your spouse or partner was around, we'll allow them to come and see you because again they're also very tense.
Yeah.
They don't come to theater. So we allow them now to come and see you a little bit. We update them. Everything is fine. Your partner is okay and your baby is fine.
Yes.
We will initiate breastfeeding for you. So personally, I'll actually hold my own, the baby to the mom's breasts. Very important. It's called rooming in because we know the benefit of that.
Yes.
Then after that, we just encourage you. Now slide off. Just sleep. Just sleep.
Just rest.
Just rest.
Umetoka mbali.
Just rest because these human beings, by the way, hawajuangi usiku na mchana. So please take advantage of those 4 hours and just rest. Yeah. Then of course you'll start noticing, we keep on telling you, Mama, don't raise your head because we don't want you to get that spinal headache that comes afterwards. So the way out for those 4 hours, you lie down. Then of course we'll give you a very good painkiller that helps you sleep it off. Then now after that, classically these days, 3 hours post surgery, it was very straightforward. We will start allowing you to take some sips of water.
Yeah.
So that by the 4th hour, tea, water, soup you can take. By the 6th hour, you're on light diet. Okay. And of course, now by the 6th hour, now the catheter is being removed. Very intentional again, because now you want the mother to start walking. I know people don't understand why we're usually very firm on, Mama, we need to walk. But it's protecting you from developing blood clots.
Oh, yeah.
Yeah. And there's that feeling of wellness when you're able to attend to yourself.
Yes.
I was able to go to the bathroom. I came back. You start noticing, especially in public hospitals, our beds are usually quite low for the C-section moms. So that by yourself, you're able to get in and out. Breastfeeding now, we want you to breastfeed this baby on demand.
Okay.
And if it's a baby who's above 4 kilos, you start noticing, by the way, your midwife is by your bedside. Mom, this baby, because they're usually at risk of their sugars dropping. Then day one, pretty much you rest a lot and breastfeeding. Then day one, you also notice we give you a lot of medication through, remember that sindano tulikuwekea? Yes. Then day 2, you're feeling far much better. Breastfeeding should have been established.
Okay.
And if it's not, please don't shy away. Advocate for yourself and say, I am not getting enough breast milk.
Okay.
We have mechanisms of helping you. We want babies to be breastfed.
Yes.
So we have mechanisms to help you get a lot of that breast milk. And then now we start switching you from ya kudungwa to ya kumeza. Okay. And then now we encourage you to eat kawaida because we are preparing you to go home on day 3. Okay. Now in between, a lactation nurse will have come around. Kukalishe chini, kuonesha jinsi ya kunyonyesha mtoto. Okay. Well, first time moms, now that's when now we start picking up who is having a problem. So we actually will keep you a little bit longer in the ward.
Okay.
Because why go home with a baby that you can't breastfeed? Then also, depending on the hospital setup again, a nurse aide will come and help you clean the baby. And you're taught how to take care of the cord. Yeah. And how it doesn't become infected. Okay. And then generally, how do you prepare for a bath of the baby? How do you bathe the baby, clean the cord, and dress them up? And then I have seen in some hospitals, a physiotherapist will come. Okay, so these will be private hospitals, okay? Who now will be teaching you, iya kufunga tumbo. It's always something people want to ask. When can I start that?
Yeah.
Yes. And then on the day you're going home on day 3, we'll teach you now how to take care of the wound.
Okay.
Yes, and what to watch out for post-delivery. And let me just point them out. Once you go discharged to go home, any severe headache, the same things when we're pregnant, you're dizzy, macho yoni vizuri, difficulties in breathing, literally unahema, then you're just coughing all the time. Okay. Then now your wound starts producing things, pus or maji. Then it's painful. Of course, we say hands off the scar.
Yeah.
Then the bleeding inapaswa kuwa ikienda ikiisha. So ikianza kukua mingi, that's a concern.
Yes.
Then it should just have the smell of blood. Nothing like something
else.
Yeah, just purely the smell of blood. It shouldn't smell anything extra. And of course, if your feet are getting swollen, but the feet getting swollen, I will have taught you on day 2 in the ward. When you're breastfeeding, always elevate your legs.
Oh yeah.
Because again, you'll see a mom who comes, she's really swollen, blood pressures are fine, workups are fine,
but miguu zimefura.
So that one is, how do you breastfeed this baby? Naketinga tu hivi vile mlinionyesha kwa ward. So we elevate.
Okay.
And then for the baby, we always want you to know a baby who refuses to breastfeed, that's a huge concern. Baby who just cries and cries. They are warm, they are breastfed, but they're just excessively crying. Fevers, turning yellow. and having rashes. Let a pediatrician see that baby before we can tell you it's a heat rash.
Okay.
Yeah. I think that's pretty much how to prepare, what happens during and how
and after.
Okay.
Now we go back to the misconception about now mama ambaye amefanyiwa CS haizi akafunga tumbo. How long does it take for one to maybe go to that?
So, okay, first of all, hiyo kufunga tumbo, please understand you're doing it for you to feel okay. Because whether you do or don't, it will bounce back.
Yes.
Because remember, the uterus was carrying this whole human being. Na ilikuwa imefika kata karibu almost all the way up here. Okay. Once you deliver, you'll have noticed now it will come down to the belly button.
Yes.
Now, over the next 6 weeks, the uterus will contract and go back. Now, we usually tell them, now you become like a girl, regular for everyone. So people will usually bind their abdomen just to feel good. So it's fine. It's by whichever time you want to.
Okay.
But many of us will encourage you after 2 weeks. So that now we have looked at our scar. It's clean and dry. It has healed.
Okay.
So after 2 weeks now, we can tell you now you can do it. But I've also met people who are doing it early enough. Okay. So the only thing now we want you now to do, so the scar doesn't become infected, your undies should always come way above the scar, not to irritate it.
Okay.
Then now your belly binder on top of it. Then at night, of course, you're not using it. Yeah.
So you're naturally.
Yes.
Hi. A woman who has a baby naturally has their private part becomes bigger than someone who has done a C-section.
Okay.
Is it true?
The vagina is a fibromuscular structure. So what that means, it will expand to accommodate the baby.
Okay.
And it will bounce back
to the original size.
Granted, it will not be to the original size. Granted, all right?
Okay.
But it will bounce back.
Okay.
And then now, remember I mentioned the physiotherapist who will now come and teach you how to tighten your pelvic floor muscles.
Okay.
Then now, right at the introitus, now, maybe there was an episiotomy, maybe there was a tear. As long as the structures are repaired correctly, you should bounce back to near a woman who has never had a vaginal birth. So that now we shouldn't use that to mean that now a woman becomes who because of vaginal birth. No. So with physiotherapy, the Kegels exercises, how to strengthen your pelvic floor muscles, you should be fine.
Okay.
Yes.
Kumalizia tu. Before I came here, a friend of mine ameniambia muulize daktari, how long should I wait after my wife has had a C-section before I start having sexual intercourse with this woman?
That's always a question that we are asked. So the general principle is as long as the woman is feeling comfortable. Okay. So if it was a straightforward C-section, we wouldn't even tell you that you wait for 4 weeks, 6 weeks. It's when the woman is feeling comfortable.
If I'm comfortable, it's fine.
If she's comfortable, you're good to go. But I don't know, some women will be willing to defy it because remember, there's the scar.
Yeah.
Okay. So that now you need to discuss with your partner. You can be intimate, usually tell partners, you can be intimate in any other ways, not necessarily penetrative.
Okay.
So that we stop looking at it purely from that angle, so that you're still maintaining the bond. So many will defy it because of that scar. And remember, after delivery, there's that, we call it the lochia, the bleeding that continues. Some people will be like,
how long does the bleeding should take normally?
Anywhere from 4 to 6 weeks.
Okay.
Anywhere from 4 to 6 weeks, but mostly by the 4th week, women are usually okay.
Okay.
So at the end of the day, it is, what is she feeling?
Yeah.
Okay. Then now, once she comes to the clinic at week 2, we confirm the scar is healing well. For majority of them, that lochia will have reduced significantly. You'll be like, things look okay. And that's why by the 6th week, when they are coming, now we want them to go home with a contraceptive. It's usually a silent
Anything
message.
can happen.
It's usually a silent message that mama is fine.
But
she's now fine, she can conceive. So just talk to your partner and figure out what's going on.
How long after a delivery through CS mtu anafaa kupata tena ujauzito? How long mtu anafaa advisably kwako anafaa kupata ujauzito?
So usually we have to answer that question very carefully. So we know the structures will have healed in 90 days.
Okay.
That's 3 months. Bear in mind, there's a mom whose baby was born sleeping. Bear in mind, there's a baby who was lost anywhere.
Yes.
for that mother, you can tell her to wait for 2 years.
Yes.
Okay. So it's usually something that I usually say you need to give a very balanced answer. So the answer is the structures will have healed in 90 days. Our wish is for the baby to be breastfed till they are 2 years. So now the earliest you're conceiving, even if it's a natural delivery, the earliest you're planning on the next baby is when this one from mikono ako miaka miwili. But like I've said, anything may have happened in between. Okay. Because now you'll meet women who come and we're in April. She had her C-section December and now she's pregnant. We're like, it's okay, ma'am. Let's go. Tuendele.
But now itahitaji a lot of care.
Yes, it will. Yes, it will.
Okay.
So if you conceive sooner, just come to the OB and we'll take care of you.
Okay.
So don't feel like, oh my God,
what have I done?
No, it doesn't need to come out. It's just extra little bit of care. So remember, at 6 weeks, mama, after delivery, please go for your birth control. Discuss with your OB again. There are various methods of contraceptives which are compatible with a breastfeeding mom. Sawa.
Okay.
And then number 2, tukumbuke contraceptives it's not a one size fits all.
Kila mtu ana dawa tofauti.
Kila mtu lazima akuje. We know what are your issues. Okay. Where are you coming from? What have you used before? What was your experience with it?
I think I'll have to call you again for this topic.
Yeah,
family planning. If you next year in Nairobi, just let me know so that we can have another sitting and we talk about contraceptives.
Thank you for having me. And then now let me finish. At week 6, mom, cervical cancer screening needs to be. So we give family planning plus cervical cancer screening.
Why?
Because the mom is not going to come back to you again.
Oh,
we know women. We know women. So we take now advantage of that. Like you've come through ANC, and women are usually very good at attending ANC. So you have delivered week 2, things are fine. When baby is 6 weeks, give her contraceptives and cervical cancer screening. Because the next time you see her, could be
akiwa na ujauzito tena.
Now we are back.
Thank you so much. Kama mtu anataka kukufuata, do you have social media platforms? Where do we get you?
Oh, if you want to find me, of course, like I've indicated, I work in Tharaka Nithi County, a facility known as Marimanti Level 4. I really love that workstation. You can also find me at the Aga Khan Clinic in Meru every Saturday.
Every Saturday?
Yes, Aga Khan Clinic in Meru.
Okay.
Yes.
Thank you so much kwa wale ambao umejiunga na sisi. Tumekuwa tukizungumzia kuhusu C-section ama cesarean section. Inaitwa cesarean section ama cesarean? Yes. C-section kwa wale ambao wamepanga ama mtu ni emergency. Please, you're also mom. It doesn't matter umepata mtoto namna gani. You are a beautiful mom. Sasa, you can share, like, if you have any comment you want to be on this set, please just inbox me on my social media at Anita Santuri. Ila kwa sasa jamani, asanteni sana, tukutane Jumatatu.
Thank you.
Karibu.